Welcome to another episode of Easy Access to Healthcare for All, a program which brings you news and issues around the National Health Insurance Authority as it drives Nigeria towards universal health coverage. My name is Aisha Muhammad Ahmed, your regular anchor. For the NHIA, giving every Nigerian access to affordable healthcare is not its only mission. Its mandate also involves ensuring that the quality delivery of the services an enrollee needs. In this episode, we shall be focusing on beneficiaries of the scheme who have accessed care. They share their experience towards sending the message that social health insurance has immense benefits and can be accessed by all. Please stay tuned for the full program after the break.
Let me see your bill. What is this in your bill?
Oh, that. It's gift ship fully paid. Are you an enrollee? Are you registered under the Group Individual Family Social Health Insurance Program? Gift ship.
Gift ship. What is gift ship? Tell me about it.
GiftShip is a group individual and family social health insurance program. Now, the health insurance is mandatory for every Nigerian. GiftShip allows artisans, traders, farmers, mechanics, business owners, taxi drivers, even keke riders benefit from a range of medical surgeries, medical tests, scans at any preferred NHIA accredited hospital in Nigeria. To enroll, an individual contributes only 45,000 naira per annum. For a family of 3, 45,000 naira per annum. Group of 10 persons and above, 15,000 naira a person per annum. This amount is renewable every year.
Moves, leaving no one behind. Welcome back. The program kicks off with a highlight of events around the NHIA and the health insurance eco space in Nigeria. Stay tuned for details.
Kaduna State Coordinator of the National Health Insurance Authority, Aminu Tanimu, has urged Nigerians to embrace the group, individual and family social health insurance program introduced by the authority to ensure that all Nigerians have a health insurance cover. Aminu, who was speaking with newsmen recently in Kaduna, said this will guarantee Nigerians access to quality healthcare services at affordable cost without exposure to financial risks. He specifically called on Kaduna residents not covered by any form of insurance to subscribe to GiftShip, explaining that the program was designed for persons under the informal sector, retirees and retiree associations, diaspora groups, foreigners living in the country, as well as those whose premium would be covered by philanthropists or members of the National Assembly. Explaining further that the benefit package is huge and can be accessed in any NHIA facility in any part of the country. The state coordinator also said that the authority was doing all it could to improve the quality of services across NHIA accredited facilities in the country. He added that Professor Nasir Sambo, the Director General NHIA, was strengthening states with the required manpower, doctors, pharmacists, lab scientists, and nurses, among others, who would be going round to access the level of service delivery to enrollees. Tanimu further appealed to enrollees who were not satisfied with the services or felt should change to report to health maintenance organizations or the nearest NHIA office, assuring that necessary actions shall be taken. The Imo State government has disclosed that a total of 63,003 people were enjoying the health insurance policy of the state government. The Executive Secretary of the Imo State Health Insurance Agency, Uche Ewelike, said the aim of the policy was to ensure that all citizens and residents of the state have access to quality healthcare services. Speaking further, Ewelike commended the state governor, Hope Uzodimma, for approving the commencement of the program for the people of the state. He said the governor has done well and is bringing quality healthcare services to the doorsteps of the people of the state.
The program is easy access to healthcare for all. The enrollee is seen as the king in the operations of the NHIA. The ease with which they access care puts the authority on a right perspective. Their satisfaction also justifies the establishment of the NHIA by the federal government. In our next segment, issues around the NHIA, we shall hear testimonials of enrollees who have accessed care under the program and are satisfied with it, as well as see what provisions have been made by the NHIA to ensure enrollee satisfaction. Keep watching as you stay tuned.
The beauty of the National Health Insurance Scheme as implemented by the NHIA is in the freedom enrollees have when they can go to any hospital of their choice and get attended to. This is in line with objectives of the NHIA, which is to ensure that every Nigerian has access to good healthcare service and to ensure efficiency in healthcare services. The NHIA, through its Department of Standards and Quality Assurance, ensures that enrollees are given the highest possible quality of healthcare service at the right price and in line with President Muhammadu Buhari's agenda on universal health coverage and the United Nations Sustainable Development Goals. For ease of making healthcare accessible, the scheme has given enrollees the leverage to choose their preferred facilities for accessibility in time of need. And to fulfill its mandate, NHIA has continued to make sure enrollees are treated fairly without discrimination when they visit the facility.
It is real that there is some level of discrimination that is happening at that level. So what we have done, I've mentioned the recruitment of medical professionals at the state, and we are developing programs where there's the recent one that we're looking at, what we call the NHIA strategy to improve the responsiveness of healthcare facilities. So we are working on several ideas that we feel. We have also developed the healthcare facility accountability framework that we will be deploying very soon. So we are hoping that with that and with the presence of the call center, one of the strategies we're thinking of is to have the phone numbers of the doctors at the state offices in every healthcare facility that is accredited by NHI. So for example, if you are in FCT, the phone number of the doctors and the professionals who are in the FCT state office will be available in every of our accredited facilities. So people can easily call in and find out and report their grievances to us and even get information if they so desire.
The NHIA benefit package is also robust and meets the daily needs of enrollees. Through this provision, enrollees have access to primary, secondary and tertiary care in times of need.
The benefit package is what brings everybody together in one basket. What everybody under the formal sector enjoy is the NHI standard benefit package. So, and the benefit package is the same. It's robust, very comprehensive. So that is just what brings all the GIFSHIP, the public sector, the organized private sector together into the pool.
Wizu Osarogo Esther is a beneficiary who has enjoyed the scheme. She shares her story.
I would like to use the opportunity to say thank you to NHIS, because when I had my first baby, they waited for 40 weeks, baby is not coming, they booked me for surgery, and to my greatest surprise, I didn't pay a dime. The second baby came, the same thing, I did surgery, my greatest surprise, I didn't pay a dime. So I keep telling people, like my colleagues, they'll say they could not wait for NHIS. I say, people, we're not patient, because if you go to the hospital and you're under NHIS, once approval comes, they'll give you, and my own is an example, 2 babies with surgery. In that hospital, they normally collect like 250,000, but me, I didn't pay 1 naira. And not only that, so there are so many minor operations I did too under NHIS. I've never paid. And one thing I would like to appreciate NHIS too is, there was a time I seek approval for scan. I don't know anybody there. Well, after doing the scan, I was surprised. They've called me. They now said, Madam, you are so person. I say yes. Were they able to carry out your scan? I say yes. Are you okay with our service? I say yes. For them to call, meaning they have in mind to let you know that your complaint gets to them, but they want to know if the hospital was able to do it for you without you passing through stress. So it's not once they've called me like twice to really ask me if they were able to do it. So I want to say that NHIA works.
Another enrollee who has enjoyed the program is grateful to the government. She shares her journey with us.
2016, I gave birth to a child that had a defect in his stomach. So we were referred to National Hospital. 2017, he had complications, though they were managing him and monitoring him, and they had to do a surgery after a month. So luckily, I've registered with NHIS, and that's for the child, and he was able to benefit free surgery the first time after a month. We kept going for management for the surgical issues. They said they will not do the surgery immediately until it's due. So all the costs for going to the hospital, consultation fee, the medication, they were always dressing the hernia. It was a giant hernia, they call it omphalocele. So the stomach did not close while so I gave birth to him, and we had to wait for like 4 months before the stomach closes. Every day we go to the hospital for 4 months for dressing and everything. We only used to buy the drugs and the items they use in cleaning the hernia, but the medication, they were handling it. Then they told us they would do surgery after 2 years or 1 year, 8 months, which they did. After 1 year, 8 months, the stomach was big, roomy enough for them to return all the intestine and close up they say there's a hole there. So they returned it, and NHIS covered for the payments too. We only bought a mesh, 20,000 if I remember, to cover it. So and the amount was really much if we were to pay directly. So NHIS covered for it. That's the second surgery. Now we were also going for like checkup up every 2 weeks. They changed it to 3 months, and before we know it, we're due to stay at home if he doesn't have complication after a year. And all these things were covered. Anytime we go for consultation, they will just give us consultation receipts. I think it was 1,500 or 1,000 like that, free. We don't pay. So I want to really appreciate governments for this program. We've benefited.
Obisesan Razak also shares with us as a beneficiary of NHIA.
My wife actually gave birth, and we used the service. So instead of us paying a huge amount of money, so they said since we're on NHIS, so I can enjoy a lot of discount, and actually I paid 3,000 for the whole delivery. So that was how I actually benefited from the NHIS service.
Enrollees are expected to also make co-payment of 50% cost of drugs. There are also partial exclusions where an enrollee pays a certain percentage on MRIs and radiotherapy. Aside that, NHIA covers major surgical procedures and consultations. Enrollees share how this has made accessing healthcare easy for them.
I've really achieved so many things through it. They have really tried. Because while I was in government work, I was the one I was using it, even together with my family. So until now that I'm retired now, and I'm still benefiting from it. So my husband is the principal now, so I'm under my husband.
I've been with the NHIS for quite some years now, and I'm a beneficiary of this NHIS program.
So I've been a beneficiary. Can you tell us some of your experience with the program?
Yeah, when I started the NHIS, I was there because I benefited from it. Because imagine in a place that you have to pay, say, 10,000 naira bill, you are paying 1,000 naira, or 100,000 naira, you are paying 100 naira. It's of a benefit to us. I benefited it. I remember when I had gas motor accident. I almost lost my life. I spent months in the teaching hospital in Benin, and it was through NHIA that it lessened the bill for me, both drugs and all. So I'm a beneficiary. It's a good thing that happened to Nigeria.
When my wife gave birth and she was admitted, it was very easy paying the 10% whatever. And I think about 3-4 months ago, I could just balance what I've been enjoying when one of my sons was above the age and he was ill, and we took him to our clinic. And because he's off NHIS, he was to pay a deposit of 50,000 before he would get a bed. So I said, wow, is this what I have been over the years? So very amazing. So we have to pay for him though. So the scheme is very, very okay.
There's a lot of benefits because, I mean, it's been able to cater for some burden of healthcare, and then at least sort that one out to a good extent.
The beauty of health insurance remains the ease with which enrollees can have access to medical care without worry about the cost. Little wonder then that under the new NHIA Act, every Nigerian, irrespective of class and age, is mandated to be under a health insurance cover. States and other stakeholders hold the key to making sure that universal health coverage is a reality.
Welcome back. Today on our Stakeholders segment, we'll bring you an interview with Bose Eddie Osugbo, Deputy Manager, ICO Multi-Shield, HMO. She begins with a view on the introduction of NHIA in Nigeria.
What I've seen so far is that it has really helped the masses. It has helped not even the masses, in fact, everybody. Because in this the situation we find ourselves now, not everybody have that money to go to the hospital. And so many people, even the providers, that is the hospital. Everybody testifies that yes, it's a good thing.
Bose Osugbo speaks on the role of the Health Maintenance Organization within the health insurance space.
HMO is Health Maintenance Organization, and which I am one of them. ICO Multi-Shield is one of them. And our work is we manage the health care of the providers, and even the enrollees that are under us, we listen to their complaints. We make sure that they are satisfied in the hospitals they visit. We make sure that everything is okay with them.
The NHIA runs a tripartite relationship with the health maintenance organizations and the healthcare providers. Osugbo speaks more on how they function.
The NHIA, they are the national, the NHIA, they are at the top, and they are the overall of the health insurance. And with the health maintenance organization, we work hand in hand with them. They supply all what we need to the hospitals and to our enrollees. Our relationship with the HCP is that, we visit all our HCPs, we listen to their complaints with the enrollees, and as well, we visit the enrollee. Like for ICO Multi-Shield now, We have one of the people, the organization we manage is the Nigeria Prisons Service. You know, we visit them also. We visit the National Museum workers. You know, we listen to their complaints. And when they, in case there is any problem with any hospital they visit, immediately we make sure that we resolve that issue amicably. And if there is anything that is beyond us, we all go to the NHIA, and they will be the one to resolve everything.
As a stakeholder, Bose Osubo commends the NHIA for its reconciliation exercise between the healthcare facilities and the health maintenance organizations.
The reconciliation exercise is good. It's very, very good. And we are all happy about it. Because, you know, we deal with so many healthcare facilities. At times, even from the head office, we may not remember to, you know, to pay some, we may, you know, pay some up to date. And some you will see that 6 months, 1 month has relapsed and they have not received their payment. But this reconciliation has really put all the HMOs on their toes. We make sure that our record must be up to date. And if even we go to the NHIA's office, you know, NHIA office, they will have to, you know, look into both issues. Why didn't you pay this thing for a long time? Madam, why did you do something like this? At times, to be frank, at times we won't even remember that this facility is there that we have not paid. But we at the branch office here, we have this year now with my colleague, we have resolved that all the CPs that have been paid, will note everything, and then the moment they send their bill, 2 weeks, 1 month, we will have to start disturbing them from the head office. Remember, these HCP have not received their payment. And in fact, the reconciliation exercise is very good.
That's a summary of our chat with the Deputy Manager of IECO Multi-Shield. Let's take your questions in this last segment of the program.
Where do I register? How can I get enrolled? Where do I register?
How can I get enrolled? How can I get enrolled?
Question: what is the giftship program?
It is supposed to be an all-encompassing program that will cover G group of people, I individual, and F family, who are not employed within the formal sector, but they are either employees of the informal sector or they are self-employed, provided they are earning salaries, they are earning income, and that income is sufficient enough to pay premium and get into the social health insurance ecosystem.
With this, we have come to the end of this week's episode of the program. We all have a responsibility in helping Nigeria attain universal health coverage by keying into the NHIA and letting more Nigerians know that they can enjoy social health insurance even if they are in the informal sector. Enjoy the rest of the evening.